So you have here, this is your interface. This is telling you it needs something.
Okay.
So it's saying hit the home button. So you have to come over here.
Okay.
So the on-off button is up here in the back. Way up here where my hand is. So you'll turn this on first, and then I boot up the computer second. So it finds it a
first
little
this
bit
and then the
faster.
computer?
Doesn't matter if you do it the other way. I just think it's a little faster to do this first and then that.
Okay.
Doesn't hurt either way.
Okay.
Now it says home button. The home button, you'd have to come over here. But this is the home button. This is the one that has the arrow going backwards.
Okay.
You're going to use that button a lot.
This is the home button.
Right. And you need to firmly press it the first time of the day. That's a trick because some people just lightly touch it and it doesn't respond. So you need to push it. Sometimes you have to even wait a little bit. The first time of the day. So right now,
You recommend us every morning just turn it on?
I don't know if she, oh, there it is. So there it goes.
Oh.
Yeah, every morning turn it
We
on.
hear the little sound that means we press it right? Okay.
Yep. See that interaction that just happened? Now if we go out in the office over there, look and see what it says now. It should look different. Oh, she's got Eagle Soft going. Oh, you got it? Oh, you exited out.
No, we forgot to connect to internet.
No, it doesn't work this way for CT.
Oh,
This is for panoramic.
do. You mean load the new exam, right?
It might be default. I'm not sure. How you know.
Hit acquire so we come out.
Well, you have to acquire first. So.
Let me see, we loaded before.
There it is. It's loaded. So now this is the driver, this is the communication with the device, and it's green. Yeah, good job. So now, but you cannot take 3D from here into EagleSoft. Remember we talked about that? Because EagleSoft doesn't know how to handle DICOM file sets. They can handle TIFF, JPEG, two-dimensional images. So you can't acquire a 3D into EagleSoft.
Okay.
Right? This is for taking an extra oral pan, extra oral bite wings, extra oral, TMJ, but not 3D.
How about panel?
Yeah, Pano, absolutely.
Are you saying that we
For the
can?
3D, we have to use directly from the software.
Okay.
not
Right.
through
But the 2D we can somehow enter.
Just like this.
Okay.
So now we made that connection and that link through EagleSoft. We hit acquire from EagleSoft. And we had a template that said Pano, and we hit new exam, acquire. And now it's going to the device. It's going to let you take a Pano.
Could you train us for both 2D and also 3D?
Yeah, the 3D, we don't go through EagleSoft because, like I said, they can't take it into EagleSoft. It doesn't know what to do with the data. That's where you go into DTX, the software that I showed you a second ago, and you find the patient name in the database there, and then you would hit acquire from there. So right now, this is set up for a Pano. This is an adult panoramic. This is child panoramic. This is extra oral bite wings, and this is extra oral, of course, TMJ. Down here is your patient selection icons. So this is a small, average, or large.
Okay.
It defaults automatically to an average size patient.
Would you repeat again the top one is adult
So this
panel?
gives you a preview of what you're taking.
Uh-huh.
So this is an adult panoramic.
Okay.
If I clicked on the next one, it's going to give you another preview. Child.
Okay.
Click on this one. Extra oral bite wings.
Oh, okay.
And the last one would be just the condyles, if you only want to image the joints.
Okay.
Okay?
The last one is
When you do
condom.
these things, you limit dose to the patient.
Got it. And then you mentioned about something on the bottom.
This is the patient size.
Patient
Small,
size.
average, and large.
Okay.
It really has to do with bone density.
Mm-hmm.
So you're trying to guesstimate the best you can somebody's bone density, which is obviously
Mm-hmm.
impossible. But you're trying to look at the mandible, their jaw, their neck, their wrist, their
Okay.
bone, See if they're really thick, short neck, stocky, broad shoulders, you're probably gonna go higher.
So how many options for the bone density?
This is it, for 3 presets.
Preset.
You can go in manually, but I don't recommend it unless you know what you're doing. Because you're changing KV.
Got it.
and
Yeah,
MA
we're not gonna mess up.
manually.
We're not gonna mess up with that. Yeah.
These are defaults. The manufacturer, us, my company, is saying these are 3 presets for you that fit most people. If you want to go customize, you can, but then you need to know what you're doing.
Yep.
So somebody that's really big, like Shaq, big giant head, right? You're gonna go high.
Yep.
And if you have somebody who's a little bit, petite, frail, on the smaller side, you're gonna go lower. But medium is a good starting point for most people. What you don't want to do is image Shaq at a child or low adult setting,
Right.
and somebody who's really petite and small at the big, large setting, because that's way too different, right? Way off. You'll have very dark images, and the other side you'll have very light, undiagnostic images.
Sure.
So these are good starting points.
Okay.
T is test. That means that you want to do a trial run with no dose. Everything is grayed out. So there's no exposure. You can stand right there in the room with them. So if you have a child who's afraid of it, you could do a trial simulation with no dose. If you have an elderly patient or somebody who's difficult to position, you could do a trial to make sure it clears the shoulders,
Got it.
right? And then you don't have to take it twice.
That's
Bumps
wonderful.
the shoulders.
That's really important. So you always click T first and then test it.
Yeah,
Okay.
always do that. You can always do that anytime you want. You can also do it on the device. There's a T. Does the same thing.
Okay.
Okay, it will go around the head.
Okay. Could you
don't
show
have
us?
to leave the room.
Would you show us the T on the device
It's right here.
real quick?
Yep. Right there. See, it's glowing
Oh,
because
okay.
it's on.
So this is
Go
the
ahead
T,
and hit
but
it. You just took it off.
okay. So
Put it on.
all right.
And over here, it's going to say. See, it's green.
Got
That
it.
means you're doing a
The test in there. Okay.
I'm going to go back up here to Pano. Right? So for this, I'm not going to. You wanted to know 3D. So right now, see, the only option you can take is a pan. Because you can't take a 3D into EagleSoft. Okay, so if you guys want to do 3D right now, then we can't go through EagleSoft to do the training.
Got it. Yeah.
And you wanted to do 3D right now, right?
Yeah, 3D. We learn 3D now. I want to learn 3D.
So we're not going to go through this way. This would be just for Pano.
Okay.
Okay? So I'm going to exit out of
Are
this.
you sure you guys?
I want to learn more 3D first, and then we're gonna go back to 2D.
Thank you.
Okay? So we're out of this.
'Cause we have so many patients. I want to take 3D, but I don't know what to do with this.
I went in up here directly. All right, so this is your patient list that's in DTX.
Okay.
You'll probably have to create the patient here. And then put their first name, last name for 3D.
So the ones from EagleSoft patients don't transfer in there?
They would if you were doing a pano, but you want your panos to be in EagleSoft. So that way you don't have to do this.
Okay.
But for 3D, you would have to manually enter it.
Enter it. Okay. And then if we were to take, like, let's say a few years pass and we want to take another 3D on the same patient, the patient would still
It's
be
already
there.
there.
We just click on them
You
and do
click
it.
on them, and then you're gonna go up here to the top where it says capture,
Uh-huh.
and you'll see this is the machine. You just click it, and now it's going to sync. And you'll see that interface should pop up again. It's connecting. And now you'll see this come up, and now look at this. We have a 3D icon here that wasn't there before. Now I'm gonna click that. And now we have a totally different GUI. Okay,
And I only get lost. You guys, can you go back really quick? Just boom, boom, boom. Just step number 1. How do you get to this one?
so you're gonna go back.
Right. I want to just see
You have the
again.
patient up. You can click on either one or create a new one, doesn't matter. And then you're gonna go up here and hit capture,
Okay.
click the device.
Okay.
Now it's gonna sync.
So you mentioned that you want to turn that on first, right? The
Yeah.
machine. Okay.
So it's on,
Okay.
3D,
Oh, that's 2D, and now switch to 3D. Got it.
right?
But we can use app to tag for the panel too, right? If we select.
You could take a pano, but then it's going to go directly into DTX. It won't go back into EagleSoft. You'll have
I
to
see, got it.
export it later.
DTX. Okay.
Okay.
There's some
then-
advantages to doing it in our software, but I understand you want EagleSoft, you want 2D in there. That's fine.
Yeah.
Um,
Is it easy to, if we tag the panel here, easy to put into the EagleSoft
yeah, you can easily.
easily?
Yeah.
Okay.
Export it. You can make a folder on the desktop with the patient's name, put it into that folder, then go into EagleSoft and paste it or import it in. You could also do copy paste.
Okay. Can you show us later on? And for the 3D, so if we tag 3D with the app, but how about when we view, can we view from EagleSoft or no? Okay.
EagleSoft is not able to view 3D volumes.
Got it.
It never was designed to do that.
Okay, so
That's
bottom
why
line,
you need to
EagleSoft
use
just only
this.
choose these two.
And you're not going to want to, honestly, when you see what this software can do, you're not going to want to use EagleSoft for 3D, even if
Oh,
they could
really?
do it.
Yeah, because this is just very
Because
powerful.
it has AI in it
Yeah.
Okay.
that automatically detects the nerve as long as you have the entry and exit of the canal. It'll map it, fill it in,
Okay.
okay? If you have a digital impression scanner, it will, when you import it, it'll marry up that volume, that STL file, with the DICOM file for the same patient. So now you have soft tissue over bone recognition, and it marries them up automatically. Most other programs, you have to click landmarks
Oh.
on the STL, and the same landmarks on the DICOM, and then you have to marry them up manually, and then you clean them up. This does it for you automatically.
Perfect.
That's cool.
Pretty cool.
That's
Very
cool.
good.
Another
That's what
thing.
we need to learn.
You import that STL file, all the teeth numbers get numbered automatically with AI, because we have algorithms that detect certain landmarks, and it knows the tooth numbers. Well, it also does that on the DICOM for the CT. Now when you click on any tooth number, any images associated with that tooth number get pulled in. So when you're doing a consult on tooth number 4, let's say you're doing an implant, you can click on that, and any images you have associated and tagged by that number come up to 12 at one time. So imagine consulting with a patient and you want to look, hey, what's the clinical what does a radiograph look like? What does the CT look like? What does the STL look like? We have a camera photo of that too. Well, it's all there. You don't have to hunt and peck and look around in your database trying to find all the data that you want to do a consult with a patient. It's there.
All right, let's see.
So now, sorry, these are all text messages and emails I'm getting. That's what you hear. So define the region of interest. Okay, so the machine is very smart, but it doesn't know what tooth numbers you want to take. You have to tell it.
I want number 3. All right.
So you would go there.
Select the tooth. Okay.
Now you notice it's turning.
Yeah, it looks like this machine turned into.
Oh yeah. It knows that you now told it I'm in the maxilla and I'm on tooth number 3,
Got it.
not in the mandible.
Okay.
Now the next thing comes, all right? You have options here. This is called FOV, field of view. How much anatomy do I need to capture?
I just
Tooth numbers are important to me. What are we doing this for?
we're gonna take out a tube. We're gonna put the implant there. I want to make sure the sinus is not too. I just want to evaluate the
hold
floor
that
of the
with you.
sinus. Yeah.
So this means 5 centimeters in height, 5 centimeters around. That is what that means. This is 6 centimeters in height, 9 centimeters around, enough to do a full arch, and some of the opposing crowns. We give you 6 centimeters because if you're doing an implant in the mandible, you need to see at least the crowns of the opposing arch for the trajectory of the implant and occlusion. If you leave those out, doctor's not going to know where those other teeth are sitting. So that's why, even though you only care about the mandible, you do need to at least capture some of the crowns of the opposing arch.
Got it.
And you'll see the lights on the face. It'll be on the face 6 centimeters in height from the inferior border to about the top, to about here where the crowns are. That's good. That's why we give you 6. 5 will be a little bit shorter and not quite as round. So maybe for 2 to 3 teeth at the most. If you're gonna make surgical guides, I don't know if you guys are fabricating guides.
But maybe in the future.
If you decide that you want to do that, you can't make a guide with a small field of view of 5x5 because when you get the guide back, it's going to rock in the jaw. So you need to capture at least the opposing arch over here, the opposite, and that way it won't rock.
I have a question, Larry.
You need to do a 6x9.
You mentioned about the 5x5. I thought it's gonna capture right here. No.
Yeah, you'll see.
Okay.
I'll go over it with you. So I just want to stress the importance of what you're trying to capture here with the field of views. So if you're doing a surgical guide, even though it's just a single implant site, your mind thinks 5x5. But oh, doctor wants a surgical guide. Then the next you have to go to a 6x9.
Okay.
Okay. If you're not doing any guides, it's just a single site and you can do it freehand, then 5x5 is fine. Okay, all the way up to 9x11 here. So that's 9 centimeters in height by 11 around. So that's enough to do upper and lower jaw and 1 condyle. You can't do bilateral joints with 11. You'll get 1, but not 2. Okay? And you can care, I don't want to see either one, right? You can block those out. So here's other stuff I'm going to show you here. You can also do this stuff by just picking. If I pick all of this sinus here, see it highlighted the entire upper arch without having to click each tooth number. And look, it automatically went to 6x9.
Did you just touch one of the two, or what
Just
happened?
click on. Yeah, you just click on that.
I can do individual teeth.
Uh-huh.
If I click too many, it's smart. Now you need to do a 6x9. You can just hit everything here. If you click down here in the bone, now you got upper and lower. And it knows that's got to be a 9x11. If I click 1 condyle, it's fine, but you won't get this one. Or you can say, I don't want that one. Does that make sense?
Got it.
Okay. Next thing you need to decide on is quality. What resolution do you want? Okay, this is the highest resolution for this FOV. This is a standard, which is default. Compromise between dose and quality. Most people will live in that area. And then low dose. Low quality, but low dose.
Oh.
So why would I choose that?
Low quality and low dose doesn't help anything. It's just more like record somehow, but we want a good record, so we have to make a good one, right? Like far right.
Right. I would say a good use of low dose is post-op. So you've already placed the implant in the bone, it's seated, and you want to see where it is in relation to the adjacent roots. Is it, how far away from the nerve?
Okay.
And is it centered in the bone? I don't need high resolution to see that.
Okay.
So I can do an FOV of 5x5 and a resolution of low.
Okay.
And that would be the same as a Dexis periapical or an intraoral sensor, about 4 to 5 microsieverts,
Okay.
which is nothing. But it's in 3D. Grainy. Well, like I said, you don't need high res to see what I just described to you. That is perfect for that. If you're doing condyle assessment and you're looking at the joints, you don't need high res. Low dose is fine for that. All you need to do is see the bone. You're not going to see disc space anyways because radiation doesn't do a very good job with soft tissue. Okay, that's where MRIs and other things could come into play. But for CT, you have to look at it as what am I trying to obtain? What am I using this for? What quality do we want? What FOV do we need? Because you're affecting dose to the patient. Okay, so I have some offices that'll make a laminated sheet, and it's called a CBCT protocol sheet. So you have the patient's name on it, ID, date of birth, male, female, all the pertinent information, patient ID, like I said, and then you'll get into the particulars. What tooth numbers? What resolution do we need? Are we making a surgical guide, yes or no? Right, you're checking on this with a dry eraser pen. Doctor usually fills it out, hands it to the staff, you guys go in, and you set it all up. You're not going to go back and forth and interrupt the doctor 4 and 5 times when he's with the patient. Oh yeah, what FOV do we need? Oh, what resolution? Oh, what tooth number? Are we making a guide? It's on the sheet, he already filled it out. You erase it, and then the next patient. That way you guys are all on the same page.
Okay.
Okay? We've done something in addition to that. We've come out with this, I think is the most important feature of the machine. It's called a scout shot. Right there. What is that? That is a preview of the patient's anatomy. It's their anatomy. You're taking it in a very low dose, but it's giving you a lateral and frontal projection. And you can determine what you need to see. So let's say doctor said we're doing an implant on number 3. You think you have it set up properly. The patient's in the machine. You do the scout. You get a lateral and frontal. And you're going to look at it and go, you know what? I don't have enough sinus. If I take this right now, doc's not going to be happy because I didn't get enough of the sinus. Or I didn't get the opposing crowns. So in the software, we allow you to adjust it. So think about a camera with an aperture where you can open up the aperture for more light. Well, on this, we're dealing with radiation. There's an aperture that you can open and you can say, I need more height, I need more radiation, I need to actually image up higher than this. So, remember this? These 3 field of views? Those are presets. But you have the ability to customize this and go anywhere in between these.
Oh, wow.
So you can say, I thought 5x5 was perfect, but now I'm looking at the scout shot, I don't think we have enough height. Guess what? I could take my mouse, drag it up on that image you took, and now it goes up to 6x5, 7x5, 8x5, 9x5. And now you look at it and go, oh, doc's gonna be happy with that. We have just what we need. And now you hit okay. Now you have a customizable field of view based on the patient's anatomy, because not everybody obviously is the same. The beautiful thing is, you guys are only gonna take what you need. The opposite is true. If you went to a 6x9 and you look at that and go, 6 is too high, what am I capturing all that height for? Or 9x11, I thought that was perfect, but that's too much.
My question is,
I can drop it to an 8, 7, 6, or 5x11. Yes?
so you say that before we take, we can see that what option we select is exactly the doctor looking for?
Yeah.
How can we review it before we hit the button?
Because when you take the image, you're gonna get a preview of it, comes up on the screen right here.
I have to take first and
Yes.
then review later. So
Yep.
it will come out not what we want, we have to retake again?
No, don't think about it that way. Think about
They have any way that we
think about
set up?
taking a preview of the patient,
Mhm.
and you tell the patient, I'm gonna take a preview. It's called a scout.
Hi.
We had a pendant activation for a medical patient, an 86-year-old female. It says this address, that she could just be walking by, it's a GPS thing. You guys don't have anybody, thank you.
No.
Yeah.
Thank you.
Okay. Lost my train of thought. So you.
So my question is, they have any option that we, after we set up, we want to review before we actually hit the button?
So-
Because we don't want the patient explore many times, like,
Yeah,
we
this
we
is what
set
you're
up and
going
then
to
we
tell
check.
them. This is what you're going to tell them. We're going to do a scout shot first. It's very low dose. This allows us to be
Still
specific
have to be.
with what we want. We're only going to have to take this image on you one time, the full 3D. Because the last thing you want to do is take a 3D just going off of laser lights, which are not very accurate, because you can miss the inferior border, you can miss the soft tissue, you can miss the incisal edges, you might not have enough height, you think you do, but you don't, and then you go back to the patient and say, now I'm sorry, but we have to take it again.
Mm-hmm.
Now you're giving them twice 2D or 3D dose,
Right.
right? That's not what you want. This, you take a low dose first. It's probably 4 or 5 microsieverts, like we talked about, very low dose. And then from there, you adjust it. You're only going to take the CT one time. 2 things. You lower dose to the patient, because you're not going to capture areas that you don't care about. You don't, and also you're not going to miss anything that you really need. And the second thing is you don't have to read any information that you don't care about.
So that patients still have to wear them, check several times, but the last one will be the
real
big one, the
Yeah.
real one.
Right.
Okay, so
First one to go for-
that's a T4? That's a T review 4?
No,
Oh,
no, don't worry about that yet.
okay.
So right now, I'm just telling you about the Scout. That's on by default. I encourage you to use it. It's up to you.
So Larry, how do you use the scowl again? You just press that?
I'm gonna
No.
take this off. Okay. So that's there.
Uh-huh.
So let's just say you choose your FOV, you chose your resolution, and now this is your scout, and it's going to say press the home button on the device. So you know where the home button is?
Yeah.
No. Show me. I don't know.
Right there.
Oh, that's the home button.
Yeah.
Can you show again? Okay, right, thank you. Okay.
Press it.
Yep.
So you want to press it, huh?
Now it's setting itself up for what you've told it. The 9:11 standard resolution, and look what it says.
Ready for scout?
Scout. So it's not a 3D, it's a preview.
Okay.
And it's going to take a lateral and frontal. It'll come up here on the screen, and you'll see it. And then you'll see a horizontal line across it. If you have your manual, and there's a little pamphlet that's in it that's a positioning cheat sheet. Here it is.
No, he got
Right
it.
here.
He got it. He got it.
I better show you than tell you. So right here is what I'm talking about. This is what you're going to see right here. Okay? That's your lateral and frontal. It's hard to see because it's so small, but there's a line that comes across right here, and it has an arrow up and down, and you'll take your cursor and drag it up or down. So if you might say, that's too much height. What am I doing all that for? Let's drop it. Let's go down a little more. Okay, now that's what the doctor wants. Or this is not centered left to right. I can take my cursor and move it left to right. Do not have to move the patient. So once you've locked this in, you say, that's just what we want. Nothing more, nothing less. Okay. Now the machine says, now we're going to take that. So your patients are going to like the fact that you're only going to take one CT on. Does that make sense?
Yeah.
So that's what we're ready for right now. Average person, 9:11, standard resolution, and a scout. So you said number 3. Okay, now I'm changing it. Standard resolution. This is good. What does it say?
So at first we go with default first, and then we try to pre-test.
Do what? The scout shot.
Yeah.
Yeah.
First we don't change anything, we go with default of the machine. Then we do the pre-test, right? And then after that we look at it to see what we can adjust.
But you do have to choose the resolution you want first. You can't choose.
Unless that we expert on that. But if we
Yeah.
don't know, then we just go ahead with the default and then adjust later.
Yeah, if you might say 5x5 standard resolution is fine,
Right.
and then scout. Now it says this. You haven't seen this yet.
Set chin reset.
Rest on upper
What is
position.
that? Well, I'll
like
show
that.
you what that is.
Set
Engineers are pretty clever with this.
set chin rest upper jaw position.
This is the standard position. The bite, the chin support here is in this manner for panos, all the time in this position. For a CT of the mandible, in this position. For a CT of the upper and lower jaw, in this position. The only time you turn it over, there's a magnet that hold this in, is when you're in the maxilla on a CT. And look at the light up here, turn green. Now what does it say on the GUI over there? It should say ready.
Ready for scout.
Yep, ready for scout, because it knows. But if you have this upside down in the wrong position, this turns off, it's no longer green, and on the machine it says set the chin
Set the
support.
chin rest.
It knows you're not in the right position. This is not in the right place.
So green is for upper and red for lower. So that's the
That is the maxilla of a CT,
What they call for that? This one, what they call for that?
chin support. Okay? So if you try to take a pano like this, it's going to tell you chin support in the wrong position. If you try to take a mandibular CT, wrong position. You try to take upper and lower CT, wrong position. So the only time again, right? The only
Maxillary.
time is when you're in the maxilla.
So this is maxillary.
Yes.
Yes.
Okay.
And you'll notice you just took away that height that was there, right?
Mm-hmm.
That is under the chin. And that's going to allow me to raise the machine up now where that space is
For
gone.
example, I'm standing here, then the chin.
Okay, what I would do now is raise them. You guys haven't seen this yet, but this is your touch screen. So you have a Z carriage. This moves the up and down carriage here. See that? And it lowers it. So I use 2 fingers, a little more surface area on this. If you use 1, it doesn't move as responsive. So I would use 2. And if you move it very swiping like this, like I'm doing very slow, it'll go a few millimeters at a time. If you hold it, it'll go much faster. So you don't want to do that with the patient. So right now you can see all this space under her chin. And you see where the lights are? So that's the top of the image we're taking, and the lower one is under here, under the inferior border. But we have a long ways to go, and for her, we wanted the maxilla, didn't we?
Mm-hmm.
Yeah.
You're not really catching much of that, are you? You're not going to be happy with that. So the lights go off. I'm going to turn it on again.
Where you turn on the light?
Right there.
Okay.
They
Okay.
stay on for 30 seconds. I'm going to move this up. Look at the lights go up her face. See how they're going up higher and higher? That's because we have the space under here. If this was turned the other way, that plastic piece would be in the way, wouldn't it? You couldn't move it up. That's what the engineers designed it this way. It's very smart. So now look how much height we have. You're very high up.
Is that the maximum height we can do, or the light?
Yeah, the maximum.
No.
Maxillary.
No, I'm saying, is that maximum
Well,
horizontal?
I don't know what it's set for. Is it 9 by 11? So that's 5 by 5. So if you wanted more height, you could switch it to 6. You could switch it to 9. You could switch it in between those.
I switched to 6'9", so that's 6.
Stand up tall. Stand up tall. See how tall she is? Look at all the space we still have. A lot of people will slouch.
Oh yeah, now go up all the way here.
No, that's too much. Yeah.
Yeah, that's where you don't want to take that much, right?
So 5 by 5.
take only up to here, the bone chip.
That's where you guys have to customize this. Don't just rely on the lasers. The lasers are a good ballpark, gives you an idea.
Can-
But when you take the scouts, that's going to tell you exactly.
Are we able to move the light down?
We adjust the
You
line,
are
we
by
can
moving
see
this.
Oh,
which
that's
one
it.
is the best.
Oh, okay.
Yeah.
And you'll see the opposite is true when you're working in, let's say, in the mandible. You'll see the lights are more under the chin and focusing on the mandible.
Would you, one of you guys stand here? I just asked you a question. So you saying that to change the this light, do you move her this thing, or you?
Yeah, move this
Yeah.
one to move this one only.
See how it
Oh.
moves? This is 5 centimeters.
Okay. Mm-hmm.
And remember, you have the scout. So let's say you decide that's not high enough. I want a little higher. You can go to 6 by 5.
How do you do?
In the software. 6 by 5, 7 by
Remember the
5,
first one?
8 by 5.
Okay.
That's why I like the scout shot, because you can be precise and only take it once. So your hands would, of course, come up here. You would remove
right
all your
here.
jewelry, any metal, put them back up. Flat apron without a thyroid collar, no thyroid. And hands there, and you walk forward until you touch my foot, which is roughly about 10 or 12 inches away from the column. So
Right
you're
here?
under the machine. I know
Oh,
it feels,
right here.
feels a little awkward. About like that.
Oh, really? You guys see that? I have to bend my
A little
body?
bit back, a little bit back. Let me put my foot in here. About right there.
As long as they,
Keep going.
I can sense
Right there.
little bend on the
A
back.
little bit on the back. A little. You want them back a little bit. You don't want them water skiing.
All right, can you,
Just a little
guys
bit.
mark right here so we can put the tab later on? Any like
Does that make sense?
It's just basically 1 foot away.
marker?
Does that make sense?
Right here, right here.
Just 1 foot.
A little bit bend the body.
Now,
Bigger. Like that? Yeah.
That's good. That's good. That's good.
don't tell the patient to look down. You put your foot there. Otherwise, they come in the machine like this. It's your foot, and they walk till they touch it. Okay?
So when they just go like this and step right here and like this and hold the hand, put the chin on. I cut a little bit bend in the
Yeah.
back.
So people that are very tall, you're gonna have patients obviously 6 foot and above. Might be difficult for you guys to position. So you would sit them down. And have a chair that has casters, like a wheelchair that can walk. You don't want them to slide around under the device. Elderly patients that can't sit still for a CT, you know, they shake and they just can't stay still. It's best to sit them down. Patients that have very broad shoulders, sit them down. So get a chair that you can scoot under here, get them under all the way and do everything as if they're standing. And then no hands on this, because they don't need to stabilize themselves on this, and sometimes they tend to shrug. So have them relax if they have broad shoulders, and have them sit their hands, under their legs here and pull their shoulders down. And that'll help to open up the space so that this doesn't hit the shoulders. Okay, you can do that for panos, CT, etc. Right? So this is the head support. And this is for positioning the patient.
And then can I ask you, so let's say I'm taking number 3, but I forgot to have this. Is that okay or no? It's not
You
going to
should
work.
have that in there because then they're going to be too far forward in the device or maybe too far back.
Okay.
This is allowing you to give them some guidelines.
So this is almost like own way there then, right?
It should always be there.
Right. But what about if I do the lower?
Go ahead, take it out.
Lower, then lift it up. Yes. The only maxillary in the other position. The
We
rest
still
is-
need this?
Yes.
And then so just how do you rest in here?
Yeah.
Okay. Somebody, them also.
Yeah.
Okay. That's the low. That's still the taking the X-ray for the lower.
So you're under the inferior border and you have enough height. Smile. Smile. Show me your
And
teeth.
look at you guys.
Show
Right
me your
here.
teeth. Smile. See, we have the crowns of the opposing arch.
But the lower not.
See that? Of course, it's not set up for this. It's not green, is it?
No.
Because you selected maxilla.
But what if I
Oh,
select
okay.
for both, then this
Upper
line should be
and
go
lower?
up like, it should be right here, right?
Yeah. Yeah, it'll go up higher, depending on what you want. But right
You
now, it's
see-
not green because you've selected
Very
maxilla.
smart.
Can
It detects for us.
can you step in? I just want to make sure I understand it.
No, you gotta take that down.
Oh, let me do it because I
No,
already
no, no,
said-
no.
Because he already
okay,
have it on
okay.
my side.
Okay.
So
See, that's upper and that's the lower. This is a 5x5.
So this
Or
is
it
this.
could be 6x9.
So the light of this
is
one.
fine, fine. Wait. Remember the fuse we select from the app? This light can move up here, depend on what you select.
So now this
Right now,
indicator,
it
this is the
just-
bottom.
But keep in mind, when you do the scout shot, you have the ability to move this line up, laser up higher and higher. depending
Oh,
on
so
what
this
you
is the
see.
border of the X-ray.
Yes, this
Okay,
is
got
that's
it.
the upper height, the upper
Got
limit.
it. Got it. Got it.
So we have 3 options.
Okay, no, I got it. Got it. Got it. Got it.
All right.
Okay.
So now for this positioning of the head, it's pretty simple. The patient would come in. I told you about moving under. Hands are here, shoulders relaxed and down, lead apron. This is your head support. This has a locking mechanism here.
Ah.
Don't just release it or it'll smack the patient in the head. Okay, hold it. Okay, step back. Watch. If I just let, so you don't want that. Have this all the way forward when they get in so that they have nothing obstructing them. This temporal should be open. And this shouldn't be like this. Should be all the way up out of the way. You don't need to use this for 2D images. You use this primarily for 3D with high resolution scans because they're going to be in the machine longer. And there's a tendency for them to shake or move more because they're in the machine longer. So I would use this on a high res. Okay, so they're going to come in, chin here, you do your positioning, then you would release this and have it touch the forehead, and then lock it. This will go up and down for smaller or larger heads. Then you would close the temporal. And the last thing you would do if you want is to ratchet this in. So you have all these contact points to keep the patient stable. A high resolution scan, they really have to stay still. If they don't, you will get ghosting. So let's say you're looking at an implant on tooth number 8, you're looking at the lateral and looking at the facial bone. you'll see a blurriness, like 2 facial bones. And you go, what's going on? Well, the patient moved. And it's very critical with high res. Low res is not as critical.
Can one of you guys try to adjust this because he demo, but
So
you guys
here,
need to learn how to do it.
1, 2, adjust up and down, and 3 and 4.
You can come on in. Like that. Right? She would be under, all the way under. Then I would lower this, release this until it touches, lock, squeeze the temporal, and then this will come down. Feel pretty secure?
Yeah.
See? It's pretty secure. If you have somebody who's elderly and can't stay still and they're kind of shaking or they breathe heavily and they're moving, sit them down.
Okay,
Do
well,
everything as if they're standing.
can I take this? I want you to try that right there. Can you
Release this.
can you test
I'm
that?
gonna open this, sorry. And I'm gonna open this forward.
Yeah, Larry. I mean, go ahead. Can you move around? I want you to test it.
First you,
Does that make sense?
no. First, move this one first.
I
Go
think
down.
so.
Move this one down. Make sure parallel, right line, yeah, and then pull that.
As long as it's in your eyes.
Yeah,
It's
that's
supposed
too
to be in your
low,
forehead.
right?
Yeah, it has to be in your forehead.
Yeah, and that one,
Mm-hmm.
lock it, and then the back. I mean the temple.
Temporal?
The temple. The temple right here.
Right here in the
temple
front.
here.
There you go.
And then the back.
Yep. And now you can ratchet that. Okay, so women that have a hair bun that sits out here, you want to release that. Because if it's sitting out here, when this tube head rotates, it can hit it. And then their whole head is going to twist.
The top one.
The top one's not really an issue, but a big ball of hair or hoodies, you have these big hoodies that sit out here like this. This has to rotate around their head. And if it hits anything back here, it's going to move the patient.
Oh.
So you want to make sure nothing is back here
So
obstructing.
no sweaters.
You could have sweaters, but if it's big hoodies that are bunched up and they have a jacket and a hoodie and it's all sitting out here, you don't want that.
Oh, okay.
Okay? Especially the hair buns, even the man buns, right? And the big buns of hair out here.
You can
Gotta
take it
release
out.
the bun.
Yeah, take it out. Take it out. She's been trapped for 30 seconds.
Okay, does that make sense? That's all there is to that positioning
So-
device. It's pretty simple.
Before you move that, you unhook this one and before.
Yep.
Remove this and then this. So,
That keeps them stable. Yeah,
Stable
stability
the
is
head.
key on high res especially. Standard 2. Low dose, not as critical. But I want you guys to be consistent.
You want to try to move it around because this thing is kind of like news to everyone.
okay.
Yeah. See if you why don't you sit in so that she can.
Let me do it. No. First, you put this one parallel with my head first. You see that?
Yeah.
And then
This.
unlock this one. No, unlock this one. And then hold
You got it, right?
one hand, unlock one hand,
You
you
understand?
hold and
It's
rest
just
in
my
my
second time
hand.
looking at it.
And then block it. You see that?
Yeah.
And then tie this
It's not
one.
that hard.
That's for the back.
You need repetition.
Right.
And then put down.
Got it. That's it. You got the idea. I think everybody need to try it. You try it too.
Okay?
Yeah. Yeah.
And release it. Release it. Put it back and lock it.
Okay.
So
Let's
after we're
let.
done with every patient, we have to lock it.
No, stay in so she can try one more time.
Because if it's forward, then they
Brenda need to
hit
try
it
it,
when they
yeah.
come in and they
Brenda
can't
will
go
try
in
it.
the sheet.
Okay.
Okay.
So 2 hand. Yeah.
Okay. One hold right here. Hold it right here. One hand here and one hand
here.
release.
Okay, it's
And then put it here and lock it.
lock it afterwards.
And then tie it right here.
Does
Tie the back.
anybody need a CT?
Tie it.
Okay.
No,
It's not tight?
Not yet.
Oh, turn it that way.
You want red?
And then pull it down
And
Okay.
and tie it.
Need to remove
That'd be
jewelry
good.
too.
Okay.
And then we'll release. Put it back.
Unless, if
That's
you don't
it.
want to image back there, if you're just
Yeah.
focusing on the
So
central.
what if I hold this one, okay?
Okay, when I release this one, I have to hold this one.
test.
Okay. Then I'll release like this, right? And for example, like this, right? Original like this. First, you hold this one, one hand hold this one, and one hand release this.
And then you bring it
Hold
closer.
the rest of my chair, my forehead.
Mhm.
You see that? Then
Yeah.
lock it. And then put this one down.
Put it down. And
Parallel with this one, parallel with this one.
then, okay. And
You
then,
see, parallel, and then you tie it. Tie the temple on the back here. You see that?
Now we release it.
Now release and then tie back. Tie
Okay,
it.
tie it.
Uh-huh. But make sure this one have to parallel with this one first, and before you tie, and this one go back here, and then you tie it in the back.
Perfect.
Okay.
Okay.
Okay, so we're gonna do a 3D
All right.
for
You need to come over here.
yeah.
So you're gonna go in here and hit plus, create patient, and you're gonna enter in this data.
The name.
Yep.
We already, can we use another patient or no?
No, you only have 2 in there. You can link from Eaglesoft.
What do you mean, new name or
Denise, so you're gonna take an X-ray.
she?
Yeah. Let her fill out so she remember.
Go ahead, Denise. Last name. Al?
You can hit OK, create. You're now in the database, right?
And hit
Now I
capture.
want you to go over here to capture.
Capture. And select divide.
Mhm.
That divide. Yeah,
Click on this
select,
one?
yeah, that's one.
The only thing you click. And now it's gonna connect. Okay.
Let's take one, two.
Now,
Let's take one
You need to
X-ray.
click on 3D.
Let's practice
And
number
what do you
3.
wanna take an image
Let's
of?
take number 3 of your 2. Or you want to take the whole mouth? What do you want?
doesn't matter.
Let's do number 3. Just focus on number 3. We're gonna take
Number 3. Okay, and now you have to choose the resolution you want.
Okay, go ahead. Select what you want.
If you click on that S, you'll see
If we don't
E
choose,
is
then
endo
it's,
Oh
resolution.
yeah. Endo. Try endo.
That's very high quality,
Okay.
0.08 microns.
Yeah. Let's try and.
That means you're gonna have to
Yeah.
stay really still.
oh, wait, can you click on that? E for
Endo,
endo, and
endo.
H for what?
High.
Okay.
If you want the numbers, this is 0.08
What do you mean high? High mean what? High density?
High density.
micron.
Micron.
High density?
Not
Oh,
density.
high
it's
what?
high resolution.
Oh,
So
high
you're taking
resolution.
more-
Got it.
you're taking more pictures,
Got it. Yeah.
and they're closer together.
So
Okay.
endo, how
So
many?
endo is
0.5?
0.08 micron. This high is 0.125. Still very good. And then standard is a 0.2, and I believe low dose is 0.32.
So that's also the exposure of.
It does affect exposure.
Right?
Every
So-
time you click through this, you change the MA
Mm-hmm.
and the time.
Oh, there we go.
Now, right now, you won't see it change because this is on. If you take this off, you're gonna see these values change,
Like this one?
right? Now click this. Now choose endo for me. Okay, that's 20 seconds at 2.8 milliamperage. High, 10 seconds at 2.8 milliamperage. Okay, go again. Standard low, you'll see, is only 1.4 seconds at 2.8 milliamperage. And that's why it's less dose, and that's why it's less quality. So you're going for the best,
Endo.
But
Right.
then, yeah.
but you really have to stay still, because you're in there longer.
Yeah.
And that's where you do want to ratchet that head support. Now you can click this for the scout.
Scale.
You're fine. Now hit the home button on the device because it knows. Now here's your patient size. You already selected average. Okay. And now you need to hit the home button. So you're working in the maxilla.
Home button.
So you need
I
an
just
apron.
press this one right here, okay?
Set the chin. Put the chin up. I'll do it for her.
Is that for?
Or anyone, why don't you do for her? So you can,
So
no.
Okay, what next?
Adjust the position first.
Okay, you.
So the first thing you're gonna do is move this forward, remember? Like that.
Okay.
So they're
Oh,
not
move forward, not
obstructed.
backward.
No,
Move
you don't want it
forward.
like this.
Move
Okay, wait,
forward.
hold on, back up. Yes, thank you. So we're in the maxilla, right? So please turn that over.
Flip it. Yeah. forgot
Flip
about
it,
this one.
flip it. Yep.
It won't work if you don't.
Oh,
Now it's happy, see? It's green.
green, good to go. I see. Got it.
So when we put it right here, when we put it
You
right
can't put it here, so this is the only place to put it. I don't know why these grooves are even
here?
here,
Oh, okay.
but you can only put them there.
Okay.
So come on in. Stand up nice and tall, don't slouch, stand up tall.
The leg more.
Okay, we're gonna move, no, just stand up tall. Don't try to get your chin in anywhere. Okay, we're gonna adjust it to you. Okay, so now I'm gonna move it up. See what I'm doing?
Okay.
Okay, we're up here.
Okay.
See that?
Yeah.
I can even go up a little more if I want. This head move up, so she's under that and on the chin. Okay, smile. Okay, that lower light is hard to see, but it's probably right about in there.
Good.
Okay, so now we can start to get the head support right. Lowering this. Okay. See that? Touching. Blocking. Squeezing. See the hair bun?
Yeah.
That's going to be a problem for this. Right? You don't necessarily need to do it, but if you'd like, I could probably do this. Let's see. There we go. You okay?
Very tight.
She's tight. That's what we want. She's going to be in here for 20 seconds, so she can't be moving around.
Okay.
If you have somebody that, like I said, moves and shakes, you're probably better off sitting them down.
Okay.
You can also move your feet forward a little bit.
So is it better just to have patients sit down?
Sit down.
You can.
Instead?
Most of the
And
time.
then-
But
For a
then-
high-res scan, 20 seconds, and they're sitting in there
Yeah.
for that long, sure, you can sit them down.
Okay.
All right, so now you're just gonna, I do this for repetition, swallow, tongue to the roof of the mouth. There is no bite stick, just keep your mouth closed like that. So now we're gonna do a scout. And we're gonna see if this is what we want. Let's go check it out. So try not to move, stay still. Okay, and it is set up for a scout. So let's go ahead and hit the button.
Where the
Do
button?
we have to have the door closed?
Nope.
Where the button?
Where's your exposure?
Does the scout have the radiation?
Yes.
Okay, so you
Where's your exposure button? They had to run it out here somewhere.
Oh, it's right here.
Oh, they just did it that way. Okay. So you could be standing right here, and this is fine. I can see the.
come here, Ajit. See, he haven't done it yet, so you can just stand right there. It should be okay.
You guys are fine with it. You have to see the patient.
Oh,
Can't run and hide. Right. Hold it down and do not let go.
you can come over here. You can see it.
So if the patient moves, panics, or something hits their shoulder, you're still radiating. You just need to let go. The law requires that you have to see it. Keep it down, don't let go. You're gonna hear a little chime. That's done now for the scout. Now don't get out of the page, just stay right there, don't move. There's her lateral and frontal. There's your preview. This is where you can say, I can clean this up. Maybe I want to focus a little more posterior, or maybe I want more anterior. Maybe I need more height.
Yeah, can I do that?
Yep.
So I want it down more. How do I move it down more?
You can't go down.
Oh, I can't move down.
Nope, that is the limit on that. But you're working in the maxilla.
No, I just want like something like right there. I don't need too high.
Then that's the smallest you're going to get right there. That's a 5x5.
Okay.
Okay, and you can center it left to right if you want to move that, or the other way.
Oh, okay.
Or you can go up this
No.
one.
I know specifically what I want. I want to move. That's what I want. And this one, that look good. Okay.
Okay.
Have it look good.
Hit
Good.
okay.
Okay. All right. Thank you. Okay.
Now we're gonna do the real thing.
The real
So now
deal.
you have the confidence that you're not gonna miss anything. Now take it. And it's very fast. When you guys get this down.
Why
it's
don't
gonna
we
be
just go this way? Like, can we?
I think you go this way. It's better for you.
hit the patient before it, but this is fine right here.
Okay.
This is gonna be a longer exposure. It'll look good.
I have one audience watching. That's me.
Now you can release your patient.
Not bad.
That was
Yeah.
the highest resolution with the smallest field.
Yeah. I think it might be good to sit down. I think
Process.
a lot better to sit down. I mean,
Bad.
no, that take a long time.
That's the longest scan because of the resolution it
So
chose.
that should be fine.
So would wait how many seconds to?
That's 20 seconds there.
Okay. Wow. Look at this. Look at this.
Now I want you to hit OK. Just hit OK. All right. Now click on the image behind that screen.
Here.
Okay. And what you can do now is just hit finish to the right. Just hit finish.
Mm-hmm.
And now the AI is going to hit it if there's anything for it to do. In this case, you don't have the IA canal. That's just a scout.
Oh, okay. So what do we do?
Just close out here.
Oh, okay.
But that's the CT.
Can we
hit the little
delete the
three
scout?
dots. Hit,
Can we delete the scout?
you
or no?
can, but they're data, so that's why we save them. Hit
Oh,
open.
okay.
Now you're going to see the AI hit it if there's anything. It'll tooth number them. In this case, like I said, there'll be no nerve mapping.
Mm-hmm.
And then obviously there's no STL or anything.
I have a question.
Yes.
Sometimes the patients they have piercings.
Yeah.
Like their nose piercings or tongue piercings.
Yep.
Would that affect the?
It will.
It will.
You should have them remove that. Because you can get some artifacts off of the metal. Yeah, they should remove that.
So what we do right here?
You don't have to do anything here. Here you go.
Oh, okay.
All right, so this is your axial,
Mm-hmm.
sagittal, and coronal. So if you move this arrow here,
Mm-hmm.
you're moving up and down through the volume.
Mm-hmm.
You got some pulp stones there.
Yeah. Let me take a look.
Now roll your mouse. You're
Oh, wow,
moving
look at it.
down through it. Or you can take this and drag it quickly.
Oh, okay. You do that. Hey guys, take a look. You have 4 canal.
Yeah, that's
4
clear as
canal.
day. 4.
You see that 4 canal?
An auxiliary.
See that 4 canal? One number 3. 4 canal. That means that you are a champion. Most people, I don't want to do people 4 canal. Take too long.
Oh, clear as
Look at that.
Wow.
Look at that.
Be nice to know that before you did endo.
Yeah, look at that. So this is the, I don't know. So this is meso here? Yeah, meso,
No, it's Dr. Huss doesn't have.
yeah, mesobuccal, mesolingual, and distal, and then palatal right here. Yeah, look at that. And then how do you get out of this
Just
thing?
double click it.
Double click? Oh, okay.
You can
And
do
then
something
let's
with that
see,
one if you wanna look
let
at
me
it,
see.
double click it.
Okay, yeah, look at this.
Look at that resolution.
Look at that.
And you can always go back to adjust it? Or once you, like,
You can adjust the contrast, the brightness. You can change the occlusal plane.
Oh, okay.
But
That's why before you check it, you do the review.
Mm-hmm.
You see that the review, and when you when you hit the
This
review,
right here, this is also very cool to see where your the sinus or the root and the sinus.
But the review you can do more. The review we can
Wisdom tooth.
the preview.
the preview.
Your baby is still right there, not coming out.
You can double click this if you want.
Yeah, this I love this
You still
one.
have
That's
baby
nice.
tooth. That's nice.
That's a baby.
This is a root. I mean, sorry, this is wisdom tooth number 1.
Oh, but it's just very
Tiny.
small.
Mm-hmm.
The short roots.
I thought you had like a baby. Oh,
Yeah,
that's
the small one.
You can also see it here.
Yeah, look at that.
Oh, that's what that's by was.
Yeah. See the location is actually kind of like more like on the lingo side. I like this the most. I like this root part here. This
So which one for root canal look?
yeah, right here. This one you study the how many canal before you do it. I see. Without this, you don't know how many root canals you have.
Oh wow, yeah. Oh, 1, 2, 3. Where 4 now?
Yeah.
Right here.
1, 2, 3, 4.
Here?
Yeah.
Yeah, you can see them.
Oh,
One,
wow, wow.
2, 3, 4.
Okay, guys, I'm giving up dendo now. I'm not doing any more endo.
Right down here is the 3D. This is the wow effect. You right click on the mouse and you can rotate it.
Okay, where do you get that? Can you go back? How do you
It's
get
already
that?
here.
Oh, okay, there.
Just double click it.
Mm-hmm.
And then right click and moves it.
And just hold and move.
You see how I very specifically focus on 3? I didn't want to get any other
You
place.
see,
Yeah.
show you this. There's no other images in here, but I just want to show you this.
Mhm.
See what this is saying? Press the space bar. Okay, we use the space bar because it's the biggest key. You just touch it. And now you hover over the teeth to whichever one you want.
3.
And it will pull, this is where it would pull up anything associated with that tooth number. So
Oh
if you
my
have
goodness,
periapicals-
that's powerful.
Now, this wasn't a great effect because it's the only image in here. But if
Can
we
you
had
redo again how you
periapicals,
select it?
if we had camera images, if we had STL files, anything we've taken that's tagged would pull up.
So we selected two.
Could
So
you
it's
show
the
one
same
more
time?
stuff, right?
Hit what?
The space bar.
Oh,
And you just hit the number that you
How do you,
want.
you said,
space 4?
Watch. Here, the viewer. Okay, I'm just showing you this too. See where it says press space bar?
Oh, here we
Excuse
go. Then
Space bar.
okay.
If I hit that one, it would focus on that tooth. And it would find anything associated with it. You'd have up to 12 at one time.
you guys can basically be,
Okay, you can add things. See under layout, I want to add cross sectionals here. I want to add panoramic. This is not a great pano, obviously. It's not enough data to make a pano.
I didn't want you to expose too much. Just one tooth is good enough to have a lot of information on
Not
that.
enough data to make a pano, but you could. Here's 3D pano. Not going to work in this case. Tooth numbers, okay? So now you can click on a tooth and say, I want to see.
Oh, I forgot. So let's say we planning to do an implant on number 3. We're going to take out that tooth.
Yep,
Do the implant. Mm-hmm.
You're going to say place an implant.
Wait, so we selected and then we select implant? We select.
Can you go back? How do you do it?
Okay, and you're going to go to implant.
Oh yeah, implant right there.
Okay, and you're going to see there's no, maybe I should try to draw out the pano here. The occlusion, right? Okay, so it did that. So now you have that. Now you're going to go to implant, and you would place an implant on this patient. Let's just say,
Number 3.
yeah, this isn't the best example. So you'll see it here. I have to rotate this. Oh. See that plus moves it, and I can rotate this. Get the plus, and you can move it.
How do you measure the root before you you select the right implant and all of
Get a
this?
measure.
Okay. So
and
that's
include-
usually that's what we're supposed to do. Right? Measure it first.
Yeah, you can
and then-
measure sorry, here, distance. Roughly 7.7 there.
You have a short root.
And then you can choose here your product here.
The okay, Nobel Active, yeah.
And you can choose your length and diameter.
Okay. Go back to 7.
See, and this tells me centered in the bone or not.
Mm-hmm.
This is your lateral, and you can see the adjacent roots. This is also another angle here, coronal.
Mm-hmm.
So you can see it from that angle if you wanted to. So you see the plus comes on, rotating comes on.
Mm.
That's the trajectory.
Mm-hmm.
Do we have a menu for this?
Not really on the software manual, but on YouTube, online, there's all these videos for this. And then you're going to get your training. The clinical trainer will come out here for 4 hours. Then you're going to have 4 hours on a webinar.
Actually, this is kind of easy. See, I can manipulate this.
He's
I like it.
figuring out. It's pretty simple.
Yeah, but we forgot.
Okay, let me just go back and how I get to the implant side. Just cancel it or what?
Well, you want to go all the way back out?
No, just right where the
Just hit
start.
cancel,
Cancel.
and you can click on the implant
Mhm.
and hit delete.
All right, so now I'm going to do implant.
Yep.
So what do I do? Click on implant?
Well, you're in measure mode right now.
Oh, okay, measure mode.
See, you're in plan is where you want to be.
Okay,
Add implant.
add implant.
And select the tooth.
What am I doing
Wherever
next?
you want to put it.
So number 3, where do I do it? Oh,
Different tooth. Let's go with different
no,
tooth.
no, just focus on this one.
That's not a good place to put it there because you can't
Where
see.
do I do?
Well, you did it. You can click on it here.
Okay, I
See
know.
the plus and the arrows that come up?
Mhm.
Keep going. There you go. Rotate it. There you go.
All
You
right.
probably go the other way. There you go. Oh, you had it.
But you look there,
Okay,
how you
let
can
go.
see it.
Now you can take the plus, yep, and drag it. There you go. You can't make a mistake.
All right. Look good. And then select. Does it tell me like what side do I need or?
It won't tell you what size you need.
You
But you
just
can
put the
obviously see
side
your
and then look at
perfing,
it.
your perfing there.
Yeah.
So-
You enter the side, and then they will tell you how it look like in there.
This isn't, this is giving you planning ideas. So you're looking at this saying, I know what size implant I can place in this area. So maybe in some cases you'll have to do some grafting.
Yeah.
Okay, right there. So
then if you go-
so can I ask you what the yellow is represent the,
Outer border of the implant.
but I'm just right there.
Oh, I'm sorry, that's the profile.
Just the profile, but
Yeah, the implant's right here.
okay.
That's spacing around it.
And what is it right here?
That's your axial and sagittal views.
Okay, got it.
So if you go back here, now if you go back to 3D patient, see it's here. You see it here. And you can move this. See, the implant's there. If you go to 3D panoramic, the implant's there.
Okay.
I don't think you can, you can still move it here. Well, that's cool. A lot of doctors like to plan in 2D.
Yeah, I just want to, but yeah, they look good.
See the floor of the sinus here.
Very good.
You can change the thickness of this if you want. A slice thickness that's really thin sliced. Look at that. If you want more
What did you say?
if
What
want
did you
more
do?
soft tissue, doctor,
Uh-huh.
you go out here to thick. It's like a pano.
Can you go back what you just did? Oh, just click on that right there.
Resize thickness. If you want thin,
Uh-huh.
slices away some of that soft tissue. It's a thinner slice, or you can go really to a single slice.
So that's a training for doctor.
Yeah.
Oh, wait,
Now
this
for
is
staff?
all training, not for you guys.
Okay.
So you'll have another probably 8 hours worth of training because they're not going to need all this.
Yeah, yeah.
So when your trainer comes out, you'll probably spend a half hour just going over difficult patients, positioning tricks, and things that you've had, maybe a little bit of struggling with, and they'll go over it with you. The rest is going to be you going over the software
how
and
to
planning
use it.
and how to use it. Any questions you have, of course, the time is yours to use as you want. But I don't think you guys need to be here for 4 hours to go over positioning,
Right.
right? And I've given you probably 75%, right, of what you need, maybe a little more.
So now that's we done 3D for them. So how about you want to go over 2D?
Yeah, I just want,
Maybe you go
2D
to
is pretty
so
quick.
they can go lunch.
Yep, I'll go fast for this. So you know how to go in through EagleSoft. You just did it. Now you're going to choose Pano.
Can I go to EagleSoft?
No, you go to EagleSoft. There you go.
oh, one of you guys
Select your
touch it so
patient in
you
the chair.
can do it so you can feel you,
You don't
whatever
have to
you,
take it. You don't have to take it.
let one of them do it so they can just use it.
It's the same as what you've been always doing. No exam, panoramic, and acquire. Same thing. Now it launches the drivers.
Longer.
There it goes.
When you take the 2D,
It's from 20.
you cannot convert to 3D, huh?
No.
Okay.
You don't have enough volume and data in there.
Okay.
There's no data.
So
Okay.
the first one is
Adult panoramic.
Carol.
Okay, so now it says set the chin rest to the right position, right? Okay, go ahead and do that. Because that's not right.
Oh, okay.
Right? Don't put the patient in. No, we don't use that. We're gonna use the bite stick.
Okay.
By stick for
That
the,
would be one of those.
Right here, I have it. So let's get this rotated. Let's hit the home button. So the machine knows you're setting up now for a panoramic X-ray, no longer doing a 2D. I'm sorry.
3D.
3D.
Okay. Green.
Good.
Green is your friend.
Hmm.
Okay, like that.
We need the cover.
Like that, all the way back. This is optional on a pan. You don't have to use this. Totally up to you. You can leave it just like that. Aprons now are not mandatory on a patient for a panoramic X-ray. The American Academy of Oral Maxillofacial Radiologists has determined that panos are not mandatory anymore. But if your patients are saying, wow, you've always put them on me in the past. Am I getting radiated? Yes, you are. I want the apron. Put it on. I wouldn't argue with them. But if you have patients that have those really broad shoulders, you've tried every trick in the book, and the apron is just, getting in the way a little bit, I would take it off. Okay? And explain to the patient that it's not really, it's not radiating you as much as the old machines used to.
Okay.
These are very, what we call collimated. The beam is very specific and refined, and it's going at an upward angle, and it's not hitting the gonads.
All of your expenses from this year, correct?
So, okay, come on in. Okay, so this is too tall for you. So we want to stretch you up nice and tall when you get in the machine. The last thing you want is a patient to come in slouching. You want to eyeball how tall they are. And then this is adjustable. So bite on that stick until 8 and 9. Open. Your smile. Your two big teeth are right in the middle of that laser light for me. Okay, now here's the cool thing. This mirror flips out. So I don't have to walk behind her to see if the image, if she's centered. So I can adjust her here. See that? So you tell a patient, make sure that laser light is between your two big teeth in the front, and they'll adjust it for you and help. If they're not biting in that notch, you guys know from the old machine, they're over it, they're behind it, their incisors need to be in that notch, the best that they can do. If this is left open, the green light will stay off, right, and it will not work. It'll tell you over there, mirror's open. Now
Here's
it's closed.
open.
It will not
Ready for
work.
pat.
All right, the laser lights went off, on again. Okay, hands are up here. Walk forward until you touch my foot. Okay, she's under the machine. Apron is optional. If I were to take this on you, I'd remove your earrings, nose rings, tongue ring, eyebrow ring, anything like that, necklaces, anything from the neck up needs to be removed. Even some metal hair clips that have a spring in them.
Even if they have it covered or like they have a jacket. it's
X-ray
still
will
taken.
not go through it. So X-ray will bounce off of that. You'll get a radio opaque image, and you'll get artifacts all throughout, scattered all throughout the image. And doctor wants to look at something. Oh, I can't see the sinus here because this artifact.
Oh, okay.
Okay.
So everything must.
So whoever calls 24 hours before, tell Mrs. Johnson that you have an appointment for a pano and we require that you remove all jewelry from the neck up. Everything. Even a nose ring? Yes, even the nose ring, tongue ring, eyebrow, everything out.
Okay.
And if they comply, which is what you're hoping for, then they come in clean, right? What's going to happen is they're not. So then you're going to have to tell them to remove it, and they're going to argue with you, I don't want to remove my nose ring, but at least you gave them 24-hour notice.
Got it. Okay.
Okay? That's all you can do. Second thing is, you don't want to be running around the office looking for their jewelry, right? They leave, come back an hour later, I forgot my jewelry. Now you guys are going, oh my God. Right? So just confirm it 24 hours.
Okay.
Okay? So you're going to come forward nice and tall. Okay? This is the trickiest part of this. There's two things. Making sure they're not favored to one side or the other. You want to make sure they're symmetrical. Okay? Looks pretty good. So you want to make sure it splits 8 and 9. Not necessarily the nose in 8 and 9, because not everybody is symmetrical like that. So you want to bisect 8 and 9. If they're missing 8 and 9, then go off maybe the center of the nose. Okay, I'll get into edentulous patients in a second, but get them centered. Okay, next thing we're going to do is this is their pano, their jaw. We don't want their chin too high, and we don't want it too low, and we don't want it flat. We just want a slight 5-degree tilt, and that gives us a nice panoramic x-ray with the condyles imaging straight up. Okay, if you don't do this, if this is like this or like this, you're going to get a lot of spinal streaking down the middle of the pano, which is a white streak, because the beam can't get through her vertebrae C1, C2, and C3 because they're basically getting pinched, closed off, and not all that x-ray can get through the vertebrae. That's why you see a streak. So what I want to do is stretch her up and then gently lower the machine. Because right now, if I were to take it right now, I am going to get a flat image for sure. I just want her profile coming forward. It's pretty subtle. So right now it's not there yet. That may be a little bit too much. See, she's starting to come forward now. Her chin is starting to come forward, her face, and now if we took it, we would get something about like that. So come over here and look. You can see that she's not straight up and down anymore, and she's not too far forward. That's about right. It's very subtle. That's about all you want from that. You don't have to worry about this canine light because it automatically adjusts and takes the image that's most in focus. There's 5 slices, so you don't have to adjust this at all. It's just the mid-sagittal and the Frankfurt. That's the horizontal line across the face here, usually from the tragus here to the floor of the orbit. I don't always look at that. I just look at her profile. That's all I care about. I know if her chin is back or too far forward, I'm not going to get the desired results, or straight up and down. I'm just wanting her to come down just a little bit. That's the trickiest. Then, like this, then lock, close the head, swallow, tongue to the roof of the mouth, lips around the bite stick like you're sucking on a straw, close that, and hold it for the duration of the exposure. What's going to happen is they will relax their tongue. They won't leave their tongue out. They'll put the tip, or they'll just drop it. When I'm smushing that whole thing up on the palate, tell them on the roof of your mouth. Everybody swallow right now. Okay, where's your tongue go?
Up.
Okay, leave it up. They're going to get lazy on you and drop it. And then you're going to see an air pocket across the pano. Right, it's going to come from here, right across the maxilla, across the apexes, coming all the way around and down, and you're not going to be able to see the roots because it's all black, because it's an air pocket. By smushing the tongue up, you avoid the air pocket and you don't get that burnout area. And it'll vary in thickness depending on how much they relax their tongue. So you'll see some really thick line, dark line, they really just dropped it. Or it might be just a little sliver. So they just barely dropped it. It's gonna happen.
If that happens, do we have to retake it?
Totally up to the doctor.
Oh, okay.
But it's not the machine's fault.
Yeah, it's the patient.
Patient. Okay, so you're here. You've done swallow, tongue to the roof of the mouth, lips around the bite stick. Why? If you open your mouth and you leave your lips open like this, even though the teeth are here, and you open the lips, radiation escapes out of the front of the mouth and you'll see burnout here. So your incisors will look all black on the edges, the outline of the lips. You'll try to lighten it up in the software and you can't correct it. It went right through and burned through it. That's why the lips have to close that area there so you don't get that burnout area.
Okay.
That's why we tell them to do it. Okay, now you're gonna hold this for about 12 seconds. It's gonna go around and then it's done. Chime at the end and let go. Okay. I know, not comfortable. She's like, I can't wait to get out of there. It's a torture chamber. She would never stay in there that long as a patient. But that is right here in this guide for you guys, so you guys can see. This is a cheat sheet for you. Okay, I just went over this one. So here, select your pano mode. Check adult panoramic. Here, these are your different options.
Okay.
Okay, patient size. Move it up and down. Use this bite stick. Now the chin support could be used for fully edentulous. You don't have to use this stick. And then chin here, excuse me, and then they would take a cotton roll, place it in the mouth to separate upper and lower so the bone doesn't overlap. Because last thing doc's gonna wanna see is bone on bone like this overlap. Okay, it's gonna drive them nuts.
The cotton will divide it on the.
Cotton roll will separate them. You can do a posterior, anterior, but as long as the bone doesn't overlap. Second thing is they want bone on bone when they're in the machine. You want a little separation. If you use the bite stick, you can do this too and put that in, but I would put a cotton roll so their gums aren't on hard plastic, right, to separate it. But I think the chin support is fine. Use that, separate upper and lower, and then positioning is all the same. Try to go off the nose, make sure they're not twisted. And then the occlusal plane, if this is my condyle and my jaw, right? So just a subtle 5-degree tilt downward. Okay, we don't want their occlusal plane here or like this. It's subtle. This picture here is it's sagittal Frankfurt. This is too straight up and down. I'd want this face to be coming forward 5 degrees. That's flat. Not the worst, but not the best. Don't need to worry about this. Does it automatically. And then your head support. Tongue to the roof of the mouth, lips around the bite stick, and fire.
So, well, Larry, just really quickly, for let's say I want to take because I do auto, but I want to take everything on it from here to here. What do I need to do?
It's a full panel.
Full panel.
Right here.
Okay. Can you
That's 8 centimeters. Oh, it's actually 15 by 30.
can you walk us through, like, if I'm gonna do like full mouth, similar to full mouth rehab or full mouth ortho case? So I might be doing 3D full mouth, so but low dose. I don't want too much. I just want to have an idea of the how.
Then you would choose your 9 by 11,
Okay.
and you would choose 3D.
Okay.
But the first thing you might take is a pano, which is 15 centimeters by 30.
I thought like when you do the 3D, you can
I'm
you
just
can
saying
you
it
can
was your protocol. I don't know what your
you can like,
protocol is.
can you attract take out from
You
3D? Can you just take it out? But the quality is bad, right?
Yeah, it's not going to be as good.
Okay. So we might have to do two, one panel for auto, one panel, and one 3D light scan,
Low dose
low dose.
or standard,
Yeah.
up to you.
Okay.
You can make a 2D out of the 3D that I showed you. You can make that. It'll extrapolate it, but like you said, it's not as good quality.
Okay.
You can do a 2D panoramic image is about 15 to 20 microsieverts, so it's about 4 periapicals. It's not that much. If you were doing an FMX on a patient, you're about 90 to 100 microsieverts.
can one of you guys just like pretend that we're gonna do ortho? So I need panel and I need 3D. Can you try to walk yourself through and see if you can get to the where we're supposed to be?
The regular panel.
Yeah, I'm gonna say okay. I need a panel now, and then if
So that's for panel.
so, yeah, just close it and just say okay. I'm ready for panel.
Okay. So we select the patient and then panel.
Yep.
You
You
have
go
to
down the
exit
bottom.
out. Exit out. Exit out.
And exit out. Okay.
Yeah, exit out because that's one already. It's not pausing.
Can you do exam by type? Oh, it's not doing anything now.
Look like it's frozen or something.
Well, then for wiping this down, you can use Naviside wipes if you want 2-minute or 3-minute kill time, and don't spray the machine.
Okay.
And this touch panel here, you can just use barrier tape on it.
Okay.
You know, you're not putting your
Yeah.
fingers in their mouth, you're not touching blood or saliva, so you
Like
don't
same thing, but you take the
Yeah.
machine.
go crazy. 'Cause there's a little board.
You test.
So maybe I think you can handle the panel. Let's try the 3D. Let's try the 3D. Yeah, panel. Everybody can do it. Yeah.
Use the harsh stuff, 1-minute kill
Here,
time, destroy
we use
plastic.
thanks again. Yeah, just select camera.
And we do this one, right? And then
Do we need 3D? Select 3D.
Yeah, 3D.
okay, so that one is there. After
Select full mount, right? We already select
You have 3D, but
Yeah.
chose the teeth of interest that you want.
oh
the
All of
whole
them.
mount.
All
The whole
of
mount.
them. So you touch the top and bottom.
oh so like
Yeah.
Right? The whole mount.
You can hit bottom too.
But it doesn't.
Oh, so because the doctor wants to take a 3D.
You're doing a scan request. It's a little
Yeah.
different.
so
So
Hit
just
capture. Capture.
oh capture.
and then hit that. And now it's going to give you the.
Oh, scan request is something else.
Yeah, that's if you're trying to scan it, request a patient scan in advance.
Oh
And then
Request
select
patient.
3D.
3D.
Right.
Request patient
And
scan
then
in
select
advance. I have no idea
upper
what
and
does that
lower.
mean.
Yeah, there we go.
And you're on high res. Is that what
A
you want?
panel too. No. Click on the jaw too. Both
Oh,
the other.
different.
Yeah. Yes.
You won't
Thank
get
you.
It
both.
won't get both.
Oh, it doesn't.
You need the 9x14 FOV.
Mm.
Automatic select for you the bigger one.
So I don't know which one you.
The whole mount. He wants the
Looks
whole
like you
mount.
selected.
Yeah. So
9x11.
Larry, how do I take? Let's say I get this, and then I want that one.
Cannot.
Can a patient stay there, and then we just scan another part, or?
You could. Do you know that you purchased the 9x14 or was it 9x11?
I don't know.
I have to look it up.
Can you? Yeah.
If it's 9x14 and that's what you purchased, then we just put a code in and it activates it. It's like a Tesla. You put the update in and it updates it.
I need the bigger one for panel for auto.
Yeah,
The 14
if you
one is
purchase the
everything.
9x11, then you don't get the second condyle. And then you would have to either scan them again or you can get the upgrade for that.
I thought I get the biggest one. Can
You
you
might
take a
have.
look?
Yeah, we got the bigger one.
If you did,
Yeah.
then all I need to do is get a code for you.
Okay.
And then it would appear here. And we select it. Email sent.
We're patient at 2 or 1.
I think we have one new patient. Oh, you were supposed to come out one, so I don't know.
Did you purchase it first?
We had two. Two. He's coming late.
I think we're good, right? I mean, you guys should go lunch now, right? I think it's late now.
I thought we were gonna do the thing, no?
Yeah,
No
but
more?
Yeah, yeah, purchase order.
Good deal. Sí, se acabó.
Right there. Is that what you signed?
It is done.
Yeah, this is showing.
the baby is hungry.
The guy never came to close the thing. He
Yeah.
just opened it, never came to
Yeah.
close it.
I have to hit myself on it
I
too.
know. Hopefully not a lot of traffic. I don't know.
Do you have any questions?
Yeah, so I just want to be able to do that one, yeah.